Well, up first, let's take a look at the number of cases in India. And India has achieved a record recovery of 1,01,468 COVID patients in the last 24 hours. Its coronavirus tally has crossed the 55 lakh mark with a spike of 75,083 cases in the last 24 hours, 1,053 deaths in that same period. Now, this is the fourth day when the number of daily recoveries is higher than the daily cases. The overall recovery rate has increased to 80.86%. The positivity rate in the country stands at 8.02% as 9,33,185 tests were conducted in the last 24 hours. India has been recording the highest number of new cases in the world since August. In September alone, India recorded an average of 90,000 cases per day until recently. So let's take a look at the most affected states and the top 5 states in the country. Maharashtra leading that list with reporting of 15,738 cases, followed by Karnataka, Andhra Pradesh, Tamil Nadu, Uttar Pradesh with 4,618 cases. And if we talk about the number of deaths, then Maharashtra is still at the top of that list with 344 deaths in 24 hours, followed by Karnataka, UP with 88 deaths, West Bengal with 62 and Tamil Nadu with 60 deaths. And let's take a look at those world numbers now. The United States is the worst affected with 68,35,394 cases and 1,99,817 deaths, followed by India with 55,62,663 cases and 88,935 deaths. Then followed by Brazil, which has over 45 lakh cases. Then Russia, which is at number 4 with over 11 lakh cases. And finally coming 5th is Peru with 7,68,895 cases. So that's how the numbers stack up worldwide. Well, now time for our newsmaker of the day, infectious disease expert Dr. Faheem Younus, Chief of Infectious Diseases, University of Maryland, Upper Chesapeake Health, and someone who's been very active on social media, sharing news and updates regarding the pandemic, answering a lot of questions also online. Thank you so much for joining us on the show today. Now, first and foremost, I'd like to talk about the vaccine race. As far as the United States goes, there's a lot of concerns there about an attempt to rush the coronavirus vaccine to fit the election timetable. In fact, a survey found that over 60% adults are concerned about this rush for a vaccine.
Yeah, we've heard some concerns from people, but at the same time, we trust the scientific community. People have spent their whole careers in making vaccines and making sure that they are safe. So at this stage, we're looking for some criteria. If the vaccine has been tested in phase 3, which is tens of thousands of people, if it has a safe and effective portfolio, and if it is approved by FDA, most of us, at least in the healthcare community, would trust and adopt that vaccine. So I understand the pressures, but at the same time, we are trying to remain as scientific as possible.
Now, human trials of the Oxford vaccine are on hold in the United States after one of the volunteers developed a complication involving her spinal cord. Even though in other countries like in India and Brazil and South Africa, those trials have restarted, they continue to be on hold in the US. So what is your view of this, especially now that we know that 2 volunteers had developed an illness? Could it derail the vaccine?
This is exactly why we do phase 3 trials. So a vaccine can be studied on 20, 30,000 volunteers so we can identify rare side effects. I think it's too premature to be worried or to even think that this will derail a trial. You are bound to have some side effects. Some of them can be very severe. The overall equation has to be looked upon. What is the efficacy of this vaccine? How many people were prevented, how many deaths were prevented as compared to whatever that side effect profile is. So I don't think people need to lose hope. I think these are good vaccines that have gone through phase 1 and phase 2 trials, and it's extremely premature. It is not unheard of and it's not unexpected to have a very few serious side effects.
All right. Now, we're seeing another wave of infections in Europe, in the United Kingdom, in France, in Spain. It's a huge concern. Do you think the months ahead are now going to be even more challenging, with the cold weather, the flu season, people moving indoors?
Exactly, and that is why I've been repeatedly telling people that we should look at April 2021 as our next goalpost, where we should reassess where we are. And what will happen between now and April are a number of things. One, we would have seen the twindemic, the potential of flu and COVID attacking countries together. We would have seen the impact of cold weather and people hunkering in within their indoors, which is a high communicable situation. We would have seen the vaccine's initial rollout to healthcare workers in frontline, and by April, we would have more data as to how effective this vaccine is. We would also have seen more trials and more studies about our treatment modalities, more faster and more available tests, and some of the political and economic uncertainty would have unfolded itself as well. So yes, I think we should remain extremely cautious until April 2021. And I'm not saying we will be out of it and we declare victory on April 2021. All I'm saying is we should reassess it at that time again.
All right, so we should know our position better in April 2021. And Doctor, if you've been following, the situation here in India, where we've been reporting massive increases in COVID numbers every single day, what are your views on the India situation?
India is a large country. There are areas that are thickly populated. No matter how hard you try, you cannot put in a structure like South Korea or New Zealand or Taiwan did. And once this virus is out with a reproductive number of around 2, of course, it's going to continue to infect more and more people. What we have today, which is probably as good as vaccine, is the triangle of washing hands, wearing a mask, and avoiding crowds and maintaining social distance. I understand it may be very difficult for some people who have to ride buses and subways and have to make a living. So I understand those realities. But still, if we stay on that message consistently, and every bit is going to help. This is not a zero-sum game. People should not look at it as win-lose. This is a spectrum. Every inch you gain is going to help the country. So I think the next 6 months, particularly while there is not going to be a vaccine for masses, we should continue to stay with wearing masks, washing hands, and trying to avoid crowd. Otherwise, this virus continues to increase.
All right, Dr. Faheem Younus, thank you so much for speaking to NDTV again.